This is Dr. Rich Vedder over at Essentia Health.
Yes.
I just want to remind people that we do have other viruses circulating in our communities at this time. Influenza, RSV, other viral illnesses out there. So just because you have symptoms doesn't necessarily mean that you have COVID-19. In fact, the likelihood that you have COVID-19 without some of those screening questions, as Dr. Griffith just reviewed, is extremely low. That the most likely is that you have some other viral illness that's in our community at this time of the year.
Okay, thank you. So we want to, Brittany already touched on this, there are going to be some drive-through testing sites, and we kind of wonder what the turnaround time is when you do get tested, but I also think I would like you to clarify, nobody should try to go access a drive-through testing spot unless they've been screened right first, right, I should say?
Correct, Charlie. So we're asking the public, if you feel like you have had an exposure, you're not feeling well, and you potentially have COVID, call your primary care provider or call the My Sanford Nurse line. They will do a screen over the phone, and we will get you to the right location. And so we actually have appointments that we will book you into our drive-through location or dedicated sites that we will direct you to for testing.
Okay, thank you. Because I think sometimes people get confused if there's a drive-through testing spot that anyone can go to it, but you want them to be screened and directed to it. So someone else jumped in. Go ahead.
We do.
Yes, this is Al Curly. Charlie, to add to what Brittany had stated, Essentia Health also has a couple sites that are going to be setting up during the next week. And so the community members and patients call ahead, call Sanford, call us at our respective lines, and get that direction so that they're going to the right place and they get access to the community. We're working collaboratively within our community to provide resources and access to anyone that needs that. Thank you.
Okay. And I'm not sure I heard this. I may have heard this in the answer, but I'll ask it one more time. Once a person has been tested, what is the expected turnaround time on results?
Yeah, Charlie, this is Dr. Griffin. So it is, I think actually it's probably better to refer to the drive-up area as test collection site. In the test is then said now the turnaround is 3 to 5 days.
Okay. All right. Thank you. So here's another question related to testing. What if we do have an increase of patients who need to be screened and then tested? Are there adequate supplies? Do you feel at your facilities to handle any kind of significant increase?
Yes, we have adequate supplies. We continue to monitor those very closely, but currently we have adequate supplies to make the collections and get the test done.
Okay, thank you very much.
Yeah, I would say